So for this video, we're going to discuss some of the miscellaneous special tests that we may use in and around the hip. And the first one that we're going to discuss is what's known as the fair test. Now the fair is a similar position as to what we see with the fadir, and the only piece that's missing here is the adduction. So what fair stands for is flexion and internal rotation, all right? And so it is a test of the posterior lateral hip, specifically the piriformis, looking for piriformis syndrome. So how it's performed is this. You would flex the individual to 90 degrees of hip flexion. The individual can be in the supine position. You could also do it in a sideline position as well. From here, you're going to take the individual into internal rotation. Now, at this point, what you're looking for is the comparable sign, specifically that pain that's elicited at the intersection of the piriformis or that proximal sciatic nerve. And so you would hope that if this was going to be positive, it's reproducing those signs and symptoms, which it would be considered more neurologic, the burning pain, the sharp, or even a numbness and tingling type feeling. And so you can query your patient and ask if it's better, worse, or no different. It is a static test moving into that greater degree of internal rotation. It's not as if it's a moving test where you're going back and forth. However, you can take the pressure off to see if symptoms are alleviated. So again, this is a fair test, flexion, internal rotation, assessing integrity of the sciatic nerve as it passes near or through the piriformis. The second test is what's known as the oscillatory pubic percussion test. Now this is used if an occult hip fracture is suspected, and what you're looking for is to use the ability of bone to transmit sound waves. And so you're going to need two devices to execute this test. The first is a reflex hammer, and the second is your stethoscope. Now your frame of reference is going to be from the femur to the pelvis. And so you're going to look at both sides, and the idea being is that if there's a fracture line, that would interrupt essentially the transmission of those sound waves through the bone, and it would sound hollow or diminished one side unto the other. And so if we suspected it on the right side, we would start with the left side to give us a reference by which to then compare our involved side to. Now, the individual needs to place this essentially right over their pubic symphysis, and so because you're getting into a region that's a little bit more private, oftentimes the best practice is to instruct the individual to palpate down in their pelvis until they feel kind of a bony protuberance. Once they feel that, you're going to hand them the bell or diaphragm of the stethoscope, and you're going to ask them to hold it with two fingers to either side right over that bony protuberance. Okay? From here, you're ready to perform the test. Place the stethoscope in your ear, and then you're going to use your reflex hammer to percuss right over top of the patella. Ideally, both sides should sound the same. Again, if you're hearing a diminished or muffled sound on the reference side, that could lead you to suspect an occult fracture or some other pathology that warrants further medical diagnostic testing. From here, an additional special test that can be used in combination with this is what's known as a fulcrum test. And a fulcrum test also is used when a bone stress injury is suspected. And so for this, we need our patient to sit up at the front edge of the table. We're going to have them slide back on the table such that their legs are supported. And what we're going to do is we're quite literally going to create a fulcrum across the femoral shaft. And so we're going to have the individual go into hip flexion, and then we're going to provide kind of a barrier with our forearm. Now I recommend kind of stacking your forearm like this versus more of a pronated or supinated position, mainly because you can get a little bit more distance as well as then allowing you to kind of support that mid or proximal portion of the femur. At this point, the fulcrum is your opposing hand is going to provide overpressure, again, fulcruming the femur across your forearm. Now, this test is considered positive if it reproduces the pain or the comparable sign, or if the individual is demonstrating a large amount of apprehension from the performance of this test. The last test that we'll then talk about that also kind of favors a bone stress injury is less specific, but can still clue you in that something is going on through the lower extremity. And so this test, we're going to have the individual actually stand up and just stand right here in front of the table. With this test, it's known as a heel drop test. And actually, just for safety, let's actually have our patient come around to the back side of the table. The reason I say safety is because there is a degree of apprehension with this, and if it is positive, sometimes individuals will experience what's known as reflexive inhibition, where because the pain is so intense, their legs will actually give out from them. The heel drop test looks like this. We're going to have the patient come up towards the edge of the table. They can use their fingers for a little bit of support. They're going to raise up on their toes, and then they're going to fall back very hard on their heels. Okay? When they do that, it's a rather jarring event. They should do it without shoes, preferably then unshod and on a firm surface. If pain is reproduced on the involved or referenced side, that clues us in that further investigation is warranted to rule out a potential bone stress injury. So, how to go with these special tests with a peer or colleague, and let me know if there's any questions.